Bismillah Rahman Rahim. Assalamu alaikum. Have you ever suffered from extreme mood changes like elevated mood, increased energy, reduced need for sleep, impulsive behavior, increased self-esteem, poor judgment, and racing thoughts at one time? And then sadness or hopelessness, loss of interest in activities, changes in appetite and sleep, fatigue and low energy, difficulty in concentrating, and feelings of guilt or worthlessness on another time. If yes, then you may be suffering from bipolar disorder. In today's vlog, we shall discuss what's bipolar disorder, what are the types of bipolar disorders, why to diagnose bipolar disorders, and why it matters. What are the causes and risk factors for bipolar disorders? What are the triggers for bipolar disorders episode? How bipolar disorders are diagnosed? What are the challenges in the diagnosis? Why early diagnosis of bipolar disorder matters? What are the treatment options for these? And what's the importance of a collaborative approach? And then role of lifestyle management in bipolar disorder. So stay with me till the end of our discussion to get answers of all these important questions. What's bipolar disorder? What does it mean? Bipolar disorder is a mental health condition characterized by extreme mood swings, including emotional highs, mania or hypomania, and lows, depression. So it's a combination of high mood and low mood, highs and depths in anybody's mood. What are the types of bipolar disorder? There are several types of bipolar disorders classified on the nature and duration of moods episodes. These include bipolar type 1 disorder, bipolar type 2 disorder, cyclothymic disorder or cyclothymia, and other specified and unspecified bipolar disorder. Let's discuss these main four types in some detail. First, the bipolar type 1 disorder. We can define this as this disorder involves at least one episode of mania lasting at least 7 days are severe enough to require hospitalization. Depressive episodes are common, but they are not required for the diagnosis of type 1 bipolar disorder. So in this disorder, there's at least 7 days episode there must be, and it should be severe enough so hospitalization is required. What are the symptoms in type 1 bipolar disorder? The symptoms are either manic symptoms, symptoms of mania, extreme happiness, or symptoms of depression. The symptoms of mania include elevated mood, increased energy, decreased need for sleep, risky behavior, and possible psychosis. While depressive symptoms indicating towards depression, these include intense sadness, fatigue, feelings of worthlessness, and difficulty in concentrating. The type 2 bipolar disorder, it involves at least one major depressive episode and at least one hypomanic episode. Hypomania is a less severe form of mania. The symptoms of type 2 bipolar disorders include, on the hypomania side, there's increased energy, talkativeness, one keeps on talking and talking, an elevated mood, but without psychosis or severe impairment. And the symptoms of depression include the same, similar to bipolar type 1, but they are often more prolonged and debilitating. The key difference between type 1 and type 2 bipolar disorder is that there is no full manic episodes in type 2 disorder. Then the third type, cyclothymic disorder or cyclothymia. It's a chronic mood disorder involving repeated mood swings that are less severe than those in type 1 or type 2. Symptoms last for at least 2 years. 1 year in childhood or adolescence is important for this. The symptoms include periods of hypomanic symptoms alternating with mild depressive symptoms. And these symptoms do not meet full criteria for mania, hypomania, or major depression. Then the fourth variety is other specified and unspecified bipolar disorder. These include conditions with bipolar-like symptoms that do not meet the full criteria for bipolar type 1, type 2, or cyclothymia. For example, rapid cycling, frequent mood episodes within a year, are bipolar symptoms caused by substance use or medical condition. The key features across different types of bipolar disorders are, number one, rapid cycling. It occurs in bipolar or type 1 or type 2 and is defined as having 4 or more mood episodes, that is mania, hypomania, or depression, within 12 months. And mixed features, experiencing symptoms of mania and depression simultaneously, such as feeling irritable and happiness with high energy. So these are the key features across different types. So the question, why diagnosis of bipolar disorder matters? Accurate diagnosis is crucial for effective treatment, which often includes mood stabilizers, therapy, and lifestyle changes. If untreated, bipolar disorders can significantly impair daily functioning and increase the risk of self-esteem. So, it increases the risk of self-harm and thus can result in dangerous outcomes. What are the causes and risk factors for bipolar disorders? The exact causes of bipolar disorders are not fully understood, but research suggests a combination of genetic, biological, and environmental factors contribute to its development. The primary causes and risk factors associated with bipolar disorders include genetic factors, brain structure and function, hormonal imbalances, and environmental and lifestyle factors. Let's discuss these main four causes of bipolar disorders in some detail. First, we take the genetic disorders. Family history is important and heritability is important. In the family history, the bipolar disorder tends to run in families. Individuals with a first degree relative, that is parent or sibling, with bipolar disorders are at higher risk. And studies suggest a strong genetic component with an estimated heritability of 60 to 80%. Specific genes linked to neurotransmitter regulation and mood stability may play a role. The second cause is brain structure and function. Neurochemical imbalances, these are one of these. Dysregulation of neurotransmitters such as serotonin, dopamine, and norepinephrine is thought to influence mood swings. Structural differences like different imaging studies have identified there are differences in the structure and function of the brain in individuals with bipolar disorders, particularly in areas regulating mood. So there are some changes, such as the prefrontal cortex and amygdala. There are definite changes in these patients as compared to the one with no bipolar disorders. Then the third theory is that of neuroinflammation. Emerging research suggests that inflammation in the brain may contribute to mood dysregulation. The third cause is hormonal imbalances. Disruptions in hormonal systems such as the hypothalamic pituitary adrenal axis may increase vulnerability to stress and mood instability. The fourth primary cause is that of environmental and lifestyle factor. Stressful life events like trauma, loss of a loved one, or financial difficulties can trigger mood episodes in susceptible individuals. Substance abuse like alcohol and drug use may both trigger and worsen episodes of mania or depression. Then sleep disturbances. Chronic sleep disruption or irregular sleep patterns can participate manic or depressive episodes. Then the childhood trauma. Adverse experiences during childhood, including abuse or neglect, they are linked to a higher risk of bipolar disorder. There are 5 risk factors, and these include age, gender, comorbid conditions, postpartum period. Bipolar disorder often appears in the late adolescence or early adulthood, although it can develop at any age. Regarding the gender, bipolar type 1 occurs mainly in men and women equally, while bipolar type 2 and rapid cycling may be more common in women. So type 1 occurs equally both in men and women, and type 2 more in women. Some comorbid conditions like anxiety, substance use, they are commonly associated with bipolar disorder. In the postpartum period, women are at increased risk of developing bipolar episodes during the postpartum period due to hormonal fluctuations and stress. What are the triggers for episodes? Three main triggers. Number one, physical illness. Medical conditions or infections can exacerbate symptoms of bipolar disorder. Then seasonal changes. Bipolar episodes may be influenced by seasonal patterns, and mania more common in springs and summer and depression in fall or winter. So depending upon the season, the mania or depression can predominate. Then medication side effects. Certain medications such as steroids or antidepressants can trigger manic or hypomanic episodes. Remember, understanding these causes and risk factors can help with early identification and management of bipolar disorder. How the bipolar disorder is diagnosed. Diagnosing bipolar disorder involves a comprehensive evaluation by a mental health professional. There is no single test for bipolar disorder. Instead, the diagnosis is based on clinical interviews, standardized assessment tools, and observation of symptoms. The key steps and criteria involved in the diagnosis of bipolar disorders include clinical interview, diagnostic criteria DSM-5, symptom assessment tools, differential diagnosis, and some additional evaluation. In the clinical review, detailed symptom history is taken. What are the symptoms? What are the triggers? For how long? The family history is important. Then in the diagnostic criteria DSM-5, different parameters, they are checked. Then there are symptom assessment tools, different. It becomes more medical and technical, so I will not go in detail of that. Then the fourth step is differential diagnosis. You exclude other causes which can mimic the bipolar disorders. There are challenges, two main challenges in the diagnosis of bipolar disorders, and these are delayed diagnosis and stigma. Bipolar disorders is often missed as major depression because it's misdiagnosed as major depression because depressive episodes are more frequent. And the stigma that patient may not report symptoms of mania or hypomania due to embarrassments or lack of awareness. So these are the two main challenges. What's the importance of early diagnosis? Accurate and timely diagnosis is essential for effective treatment, reducing the risk of complications like suicide, impaired relationships, and poor functioning. What's the treatment of bipolar disorders? The treatment of bipolar disorder aims to stabilize mood swings, reduce symptoms, and improve overall quality of life. Effective management typically requires a combination of medications, psychotherapy, and lifestyle adjustments. And these includes medications, psychotherapy, lifestyle modifications, then the electroconvulsive therapy, hospitalization, and later on long-term treatment. What's the role of lifestyle changes in the management of bipolar disorders? It's very important. Lifestyle management is a crucial component in the long-term treatment of bipolar disorder. Adopting healthy habits and maintaining a structured routine can help stabilize mood, reduce the frequency of episodes, and improve overall quality of life. So one is establish a consistent routine of your life, your regular sleep schedule. Aim for 7 to 9 hours of sleep. This is very important. You should be able to manage your stress. Then regular physical activity, it's very important. Your diet should be balanced, and there should be a mechanism or mood tracking. The monitoring of your mood can help identify triggers and early signs of an episode. This is very important. And if unfortunately someone is using substance, so limit substance use. This is very important. Then another important aspect is build a strong support system, social connections. They provide emotional stability and reduced feelings of isolation. Then therapy and psychoeducation. Of course, avoid overstimulation. Stick to your treatment plan, which has been suggested to you by your doctor, and learn coping strategies for mood episodes, for mania, and for depression. You should be having a plan for emergencies. And the most important is celebrate progress. Acknowledge small victories, such as sticking to routine or managing stress well. Self-compassion is vital recovery, and it's a journey towards the success of your overcoming the bipolar disorder. So, dear viewers, in today's vlog, we discussed what's the bipolar disorder, what are its types, what are the causes and risk factors, how these are diagnosed, and how these are managed, and what's the role of lifestyle changes in overcoming bipolar disorders. So, think positive, act positive, try to spend a healthy life, and if you feel that you or any one of your relatives, friends may be suffering from bipolar disorder, it's the time, go to your doctor, consult your doctor, seek the medical advice, and get the help how to overcome your or your relatives' bipolar disorder. Take care. Khuda Hafiz.